So what does hypovolemia mean and what causes it? Hypovolemia, hypo is low and volemia is volume. But speaking of decreased blood volume and particularly the volume of circulating plasma in the blood. What causes it? Hemorrhage, so you're losing blood somewhere, some part of your body is bleeding, whether internally or externally. Or dehydration, you're losing fluid, vomiting, diarrhea, excess sweating, so somewhere your fluid is going somewhere there too. And burns, you have plasma loss. And in third spacing, you have your fluid that shifts to interstitial space, like if you have ascites or peritonitis where your fluid is collecting somewhere else, like inside the abdomen. Diuretics. You can also have sepsis, or if you've went through some sort of trauma where you've lost blood. Your venous return to your heart decreases, so your cardiac output drops as well, which means your perfusion to your organs is reduced, which means the heart isn't pushing the blood out to all of your organs at the rate that it should, which means your oxygen level is lower. So your body tries to compensate by vasoconstricting. So what that means is your vessel, if it looks like this big, it constricts it down to be smaller. So that way you can push it through a smaller area, you get higher blood pressure. And it increases your heart rate and your body starts to retain fluids via the renin, angiotensin, aldosterone system. I always think of low blood volume or low blood pressure. I always think of it as a water hose. If you don't have enough water in your water hose to push it out, when you try to shoot it out of your nozzle, it's not going to give you the spraying power that you really want. If you're trying to water your flowers, but you don't really have the water coming out in through the hose, then you don't have enough water to spray outward at your flowers, if you want to look at it that way. So if you don't have the blood volume or you don't have the blood pressure, your body needs to vasoconstrict it down to push it out at a better rate, which increases your blood pressure by vasoconstriction. Signs and symptoms of this: tachycardia, because I said before it's increasing your heart rate. Hypotension, if you don't have the volume to fill your veins or your arteries, so you are losing the blood pressure, which is hypotension. You have pale, cool, clammy skin, weak pulse, dizziness, fainting. You're losing oxygen because you don't have the blood to pump out, getting a lower oxygen rate to all of the extremities and everywhere else, which is going to alter your mental state if you're not getting oxygen to your brain. So your treatment is to identify and treat the cause. For one, stop the bleeding if it's from internal or external bleeding, or treat the burns or sepsis. You want fluid resuscitation, normal saline, lactated ringers, blood products, packed red blood cells, plasma, platelets, if it's hemorrhaging. Oxygen administration, want to give oxygen, because as I said before, the blood is what transports your oxygen, and you're going to want to support your perfusion. You want to monitor your vitals, so your urine output. So what does this mean for the OR? You want to be aware of anything that's bleeding or if you've had a lot of blood loss, because then you're going to have a low blood volume if you've lost a lot of blood. You're going to want to pay attention to how much blood is in your suction canister and your laps. If you've suctioned up a lot of blood, or your laps are soaking wet and you've got a lot of them, you may have lost a lot of blood. In that case, you're going to want to know where your hemostatic agents are, your vascular clamps, your suction, cautery, sponges, etc. Your circulator may start giving blood. You're going to want to know where your blood and your fluid warmers are. So what does that mean for exams? I would remember that hypovolemia decreases your blood pressure and increases your heart rate. Your early signs are tachycardia, as your body tries to pump blood faster. Your late signs is hypotension, where your body's not compensating even with vasoconstriction, so you don't have the blood pressure that you need. You're going to treat it with fluids and blood if needed. So if you lose a lot of blood, you're going to have to give fluids and blood to recompensate and re-add it back into your system. It can lead to hypovolemic shock. So there's some things you might want to remember for like an exam.